we are getting ready to roll up our sleeves for flu shots and the flu season. So what can you do to be ready and get your family ready too? Welcome Dr. Joseph Gardner, Chief of the Department of Medicine at the Hospital of Central Connecticut. Good morning to you. Thank you for coming in.
Thank you.
Here we are. It seems like, you know, you finish summer and boom, you're head first into flu season. Is there any way to predict what kind of flu season we're going to have this year?
It's very difficult to predict either the severity or the exact timing. The maximum month for flu activity is usually February, but again, it can vary as early as November, as late as May.
It can be full of surprises, that's for sure.
Correct.
So the best way to get ahead of it, I guess, is to get ahead of it and to protect yourself and your family. What's the best way to do that?
Yeah. Vaccination, the CDC recommends anyone 6 months of age or older should receive the flu vaccine.
When it comes to, you know, sometimes there's a bit of alarm for some groups thinking that flu vaccine may not be for me. Pregnant women, there was a study related to miscarriages and the flu vaccine. Is there a link?
Yes. I think it's too early to say anything definitive. You are correct. The CDC did a study in which they identified an increased risk of miscarriage during the first trimester. Prior studies in the past had not shown that link. The CDC is continuing to study the issue, but as of today, they've not changed their recommendation that pregnant women be vaccinated for influenza.
So have a conversation with your doctor, it
Absolutely.
sounds like, really discuss that. Who's at risk for getting the flu? I mean, are we all at risk? We're all out and about and mixing and mingling and, you know, who is at risk for this?
We're all at risk.
Yeah.
The elderly, the very young, and the immunologically injured individuals are at greatest risk, but everybody's at risk, and it can be a severe illness even in otherwise perfectly healthy people.
Well, it can be deadly even. I mean, it is something that we have to really take seriously. People often think the flu and a cold is oh, I've got the flu. No, you have a cold. You know when you have the flu, right?
That's correct. Those who've had influenza know it's different. It's much more severe.
Yeah, it lasts a long time, and boy, those body aches are horrible. All right, this is really good information. Thanks so much for coming in this morning, Dr. Gardner. We really appreciate it. And if you want to learn more about the upcoming flu season, easy to do. Just head to our website, go to NBCConnecticut.com and search flu. Still to come, as President Trump heads to Las Vegas, we are hearing more about the victims, the survivors, and the heroes that